Namaste and welcome to another episode on Doctor Fitness. We have been posting several videos on topics that you may find helpful when you're taking care of your loved ones, elderly ones at home. So we have posted several educational videos, and this is just one of them. So today we'll talk about constipation when taking care of your elderly and frail people at home. So today's talk will be in English, but I will be sharing the PowerPoint in Kannada and Hindi as well. But uh, I will be talking just in English and not in these two languages. When you're watching any of our education videos, please note that this is not to be used as a prescription or a substitute for any doctor's advice. This is just an additional tool for you to help you and to arm you with when you're taking care of elderly because it can be so challenging taking care of them. So constipation is quite common in the elderly people. So let me first define what constipation is. Constipation is can be defined as fewer bowel movements a day. It can be lumpy stool. It can be feeling of hardness in your anus, feeling of fullness in your anus, and sometimes people even have to do a digital disimpaction or put their finger to bring the feces out. So any of these things, when people are doing it, constitutes constipation. This is really not the technical definition of it, but it's pretty close to it. So, constipation in community dwelling people has been shown to be anywhere between 25 to 50%. But the older a person gets, constipation gets very, very common. Not that constipation becomes inevitable as people get older, but just that they have more issues that pile up on them as they get older. So they may have conditions such as Parkinson's disease or diabetes or untreated hypothyroidism. On top of it, they may end up having surgery or they may have a prolonged hospitalization, prolonged illness, malignancy, or they just or depression and they don't and they stop eating. So it could be any of these reasons. There are also certain medications that they're taking that may be constipating them. So as each condition piles upon them, constipation just becomes more common. So when you do take your elderly person for a doctor's visit to see your healthcare provider, sometimes your doctor may choose to do certain tests to exclude certain serious causes before they treat constipation. So some of the more common causes of constipation are these. So one is lack of dietary fiber, poor intake of food because the amount of food also does matter, main mobility, and then certain medications like I previously talked about. So it's very important that you take a list of your medications to the doctor's office, including all the supplements, all the vitamins, anything that you may take, because several medications can cause constipation. Addressing immobility is also very important. Then, so I'll tell you why lack of dietary fiber is very common. So people, when they do not have an appetite or they're recovering from illnesses due to all the causes that I told you earlier, they resort to eating comfort food. They may just eat something like curd rice or dal chawal or bread and jam, and they really their diet lacks fiber, and it really makes them very, very constipated. So what we can do is to prevent and to treat constipation. What we can do is, first of all, add dietary fiber. So how can we add dietary fiber? I'm sure all of you are doing it. You're just trying to include more vegetables, include more fruits, then nuts, of course, and everything in the lentil family, all of them. And in fact, millets, all of them do have more fiber in them, right? So we need to include that. So if a person is not able to chew and swallow, you can actually give this to them in a liquid form. You can juice it up. You can juice up vegetables also. You can add nuts to them. You can add seeds to them. You can add, you can juice up all of these things and give it to them. But we always prefer, whenever possible, that they eat their fiber. So also good examples is addition of vegetables or something like banana. We also like things like dates, prunes if they're available, and also raisins or dry grapes. So these are all excellent sources of fiber. Sometimes just dietary fiber alone is not enough, and we need to give supplemental fiber. So supplemental fiber can be given in the natural form or in a synthetic form, such as metamucil or citrusel or benefiber, and they go by several brand names. Supplemental fiber, you can give them a spoon of it, dissolve it in hot water, and tell them to drink it immediately. because if they don't drink it immediately, it gets a little thick, it gets a little gooey, and then may not be very palatable. So always tell people to drink it immediately. You can give this with water, but if you're looking at giving them more calories, you might want to give this with milk as well. So one thing to remember when you're giving fiber supplements is that patients should be in a condition to drink enough water with the fiber. So generally, about half a cup or 1 cup mixed in it will be enough. If they're not able to drink water at all, then fiber supplements can actually bind them up because these are all bulking agents. And the other important thing to remember when giving fiber is to give them regularly, or daily, twice a day, or at least alternate day. Otherwise, bowel movement becomes erratic and unpredictable. So I frequently have people who come to me, they say that, oh, my father had bowel movement today, so I did not give him the fiber, or he did not have it for 2 days, and then I gave him fiber. And so it becomes very unpredictable that way. So it's very good to give fiber supplements regularly, preferably daily. And we already talked about taking a list of your medications and stopping all the unnecessary medications that a person may be on. So what do we do when fiber alone is not enough? Then we move on to an osmotic agent such as polyethylene glycol. So it goes by various names such as PEGMU or Miralax. I'm sure there's several other names for it. So this can be mixed with the fiber supplement. It can also be given by itself if patient absolutely does not like or cannot take the fiber supplements. In the long run, we always prefer that patients manage their constipation with fiber supplements, or sometimes with polyethylene glycol or PEGMU. But sometimes that alone is not enough, and they need something called lactulose, or the other agents may not work for them. So lactulose is easier to use since it comes in a syrup form. So for people who are not able to drink liquids, lactulose syrup is very handy, and it's also handy for those people who have severe constipation. It can also be given as needed, but lactulose syrup sometimes give rise to unpredictable and sometimes loose bowel movements, not solid physiological bowel movements like you get with fiber, but this is definitely necessary in some people. So you might have also noticed that some people do take enema, or doctors give them enema. So enema is very good in management of very, very bad constipation. And but however, giving them enema regularly can make their bowel dilated and muscles weaker. So it actually enhances constipation. It actually worsens constipation in the long run. So in the fiber supplements are actually very, very safe even for long-term use. You can use fiber supplements for years and years without having any ill effects to the colon, as long as you're taking it with adequate amount of water. So sometimes stool is so hard, or constipation is so severe, that it gets impacted in the rectum, and doctors do have to do what we call the manual disimpaction. So literally, there's a lot of hard stool that is sitting there in the rectum, and you do have to put your finger in to dislodge it. That way, they start having normal bowel movements. Another thing I wanted to talk to you about is something called overflow diarrhea, which is not so uncommon in older people. But so people like this usually have very bad constipation, and then after several days, sometimes they may have like liquid stool ooze out. So this is how it is. So there's a lot of hard stool in the rectum. Then the stool higher up, which is normal in consistency, sometimes tends to ooze out. So people mistake them for diarrhea and start taking antidiarrheals, which is very detrimental because it worsens constipation. So if you do suspect this, again, please go to your doctor. Your doctor may do a finger exam, do other tests that may need it, sometimes just something as simple as an abdominal x-ray, and then treat the constipation. So thank you so much for watching our YouTube videos. Like you know, we have other topics in geriatrics that we have posted, such as urinary incontinence, diaper rash. We also have exercises for bed-bound people, and we will have several more in the future. We also have exercises for certain conditions like chronic neck pain, chronic knee pain, chronic low back pain, and other exercises as well. So thank you as always, and feel free to comment and let us know how we're doing, and have a great day.